Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
First, we will be discussing articles in New England Journal of Medicine. Tolebrutinib in non-relapsing secondary progressive multiple sclerosis. Background. Throughout the course of multiple sclerosis, gradually progressive neurologic impairment can occur, which has been called disability accrual. Current disease-modifying therapies for multiple sclerosis have limited effects on disability accrual unrelated to relapses, which is thought to be partially caused by chronic, non-resolving neuroinflammation within the central nervous system. Tolebrutinib is an oral, brain-penetrant Bruton's tyrosine kinase inhibitor that targets myeloid cells, including microglia, and B cells in both the periphery and central nervous system. There are no approved treatments for non-relapsing secondary progressive multiple sclerosis. Conclusions. In participants with non-relapsing secondary progressive multiple sclerosis, the risk of disability progression was lower among those who received treatment with tolebrutinib than among those who received placebo. Tolebrutinib versus teriflunomide in relapsing multiple sclerosis. Background. Tolebrutinib is an oral, brain-penetrant, and bioactive Bruton's tyrosine kinase inhibitor that modulates peripheral inflammation and persistent immune activation within the central nervous system, including disease-associated microglia and B cells. More data are needed on its efficacy and safety in treating relapsing multiple sclerosis. Conclusions. Tolebrutinib was not superior to teriflunomide in decreasing annualized relapse rates among participants with relapsing multiple sclerosis. Next, we will be discussing articles from Journal of American Medical Association. Spironolactone versus Amiloride for resistant hypertension. A randomized clinical trial. Question. In patients with resistant hypertension who are taking angiotensin receptor blockers, calcium channel blockers, and thiazide, is Amiloride, a potassium-sparing diuretic, non-inferior to spironolactone for lowering blood pressure? Findings. In this open-label, blinded endpoint, randomized clinical trial involving 118 patients with resistant hypertension, Amiloride and spironolactone lowered home measured systolic blood pressure by 13.6 mm Hg and 14.7 mm Hg from baseline, respectively, with no difference in blood pressure lowering effect, meaning these results support Amiloride as a possible alternative to spironolactone as a fourth-line agent in patients with resistant hypertension. Next, we will be discussing articles from Annals of Internal Medicine. Medical, Societal, and Ethical Considerations for Directed Blood Donation in 2025. In the United States and other high-income countries, blood donation primarily relies on anonymous, voluntary donors. However, directed blood donation, where people donate for a specific recipient, has resurged, particularly due to misinformation surrounding COVID-19 vaccination. Requests for non-vaccinated blood, driven by misconceptions about vaccine safety, have led to legislative attempts to mandate compliance. Historically, directed donation was used to mitigate the risk for transfusion-related infections before modern screening techniques rendered it largely unnecessary. Today, it presents important patient safety risks, including increased infectious disease transmission, immunologic complications, and logistic burdens. Directed donations also introduce inefficiencies, diverting resources from the community blood supply and exacerbating shortages. Moreover, directed donation for non-medical indications lacks scientific justification. Blood safety is ensured through rigorous donor screening, pathogen testing, and processing measures. There is no evidence that blood from vaccinated donors poses risk. Requests for non-vaccinated blood, as well as other directed donation preferences based on personal beliefs, introduce biases that are not grounded in medical necessity. Accommodating such requests undermines public trust in blood safety protocols and legitimizes unfounded fears. Ethical concerns arise as non-medically justified requests reinforce discriminatory practices, such as selecting donors based on race or gender. Allowing such preferences risks politicizing blood donation, spreading misinformation, and straining healthcare systems. Although autonomy is a core ethical principle in medicine, it does not justify non-evidence-based interventions. Given the potential harm and societal impact, directed blood donations should be limited to rare, medically necessary cases. Ongoing legislative efforts to mandate these requests require unified opposition from the medical and scientific community to uphold ethical, evidence-based blood allocation practices. Next, we will be discussing articles from British Medical Journal. Use of gabapentinoid treatment and the risk of self-harm, population-based self-controlled case series study. Objective: to estimate the effect of gabapentinoid treatment on self-harm conclusions. The association between gabapentinoids and risk of self-harm seems to be multifaceted. An elevated risk of self-harm is present before initiation of gabapentinoid treatment, which persists during the initial phase of the treatment period, and rises again shortly after treatment discontinuation. These findings do not support a direct effect of gabapentinoid treatment on self-harm, but underscore the necessity for close patient monitoring of self-harm throughout the gabapentinoid treatment journey. Next, we will be discussing articles from Lancet. Clinical presentation and epidemiological assessment of confirmed human mpox cases in Democratic Republic of the Congo, a surveillance-based observational study. Background: mpox, caused by the monkeypox virus, is a serious public health threat in Africa, especially in Democratic Republic of the Congo. Previously limited to endemic areas with clade 1A, monkeypox virus has recently spread to non-endemic regions, where clade 1B has emerged. This study provides a clinical comparison of mpox cases in Democratic Republic of the Congo regions where clade 1A and clade 1B are prevalent interpretation. Our study indicates concurrent mpox outbreaks in Democratic Republic of the Congo, involving younger individuals, a higher proportion of women and girls, and distinct presentations with higher lesion counts and respiratory symptoms compared with clade 2B lineage B.1 outbreaks. The high proportion of infectious complications and case fatality rates, especially in endemic regions, emphasize the need for timely antibiotic therapy and targeted vaccination to reduce morbidity and mortality. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Hepatology, a new generation of non-invasive tests of liver fibrosis, with improved accuracy in MASLD. This study evaluated 9 NITs for advanced fibrosis in MASLD. Currently recommended NITs had insufficient diagnostic accuracy, less than 80%. Thus, we developed new NITs using a novel multi-targeted machine learning method. FIB9, free calculator available, including common markers, had similar accuracy to patented NITs. FIB12, including the same markers as FIB9 plus specialized markers, outperformed all other NITs. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Physiological data collected from wearable devices identify and predict inflammatory bowel disease flares. Background and aims. Wearable devices capture physiological signals non-invasively and passively. Many of these parameters have been linked to inflammatory bowel disease, IBD, activity. We evaluated the associative ability of several physiological metrics with IBD flares, and how they change before the development of flare. Conclusions. Longitudinally collected physiological metrics from wearable devices can identify and change before IBD flares, suggesting their feasibility to monitor and predict IBD activity. Here are the articles from Clinical Gastroenterology. Reproducibility of the AG2 tool for assessing the methodological quality of clinical practice guidelines for the management of antithrombotic agents in patients undergoing GI endoscopy. Background. Clinical practice guidelines, CPGs, exist for the management of antithrombotic agents in the periendoscopic period. However, their methodological qualities vary. The Appraisal of Guidelines for Research and Evaluation 2, AGRI-2, tool, has been validated for the assessment of the methodological quality of CPGs. However, its reproducibility has not been assessed. The goal of this study was to assess the reproducibility of the AGRI-2 tool for CPGs published within the last 6 years for the management of antithrombotic agents in the periendoscopic period. Conclusions. Our study shows only a fair overall inter-observer agreement in the methodological quality of the included CPGs. The results suggest the need for education and training of CPG raters to enhance the application of the AGRI-2 tool to improve its reproducibility. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Genetic and lifestyle risks for coronary artery disease and long-term risk of incident dementia subtypes. Background. Shared genetic and lifestyle risk factors may underlie the development of both coronary artery disease, CAD, and dementia. We examined whether an increased genetic risk for CAD is associated with long-term risk of developing all-cause, Alzheimer's, or vascular dementia, and investigated whether differences in potentially modifiable lifestyle factors in the mid to late life period may attenuate this risk. Individuals who are genetically predisposed to developing CAD also face an increased risk of developing dementia in old age. This risk is reduced in those demonstrating healthy lifestyle profiles earlier in the lifespan, particularly in those who may be at an increased risk of developing dementia caused by an underlying vascular pathology. Here are the articles from Journals of the American College of Cardiology. Ischemia on dobutamine stress echocardiography predicts efficacy of PCI. Results from the Orbita-2 trial. Background. Orbita-2, the placebo-controlled trial of percutaneous coronary intervention for the relief of stable angina, found that percutaneous coronary intervention, PCI, relieved angina in patients with single-vessel and multivessel stable coronary artery disease, CAD, on little or no antianginal medication, whereas symptom characteristics and invasive physiological assessments can predict PCI efficacy. The role of non-invasive imaging with dobutamine stress echocardiography, DSE, remains unclear. In patients with single and multivessel stable CAD on little or no antianginal medication, the placebo-controlled efficacy of PCI was predicted by the degree of ischemia detected on DSE. The greater the burden of baseline ischemia, the greater the improvement in symptoms and quality of life with PCI. From JAMA Cardiology. Trajectory of cardiovascular health across childhood and adolescence. Question. What is the natural history of child cardiovascular health, CVH, in early life? Findings. In this cohort of 1,523 children, across demographic subgroups, the trajectory of CVH scores began to decline at approximately age 10 years, associated with health behaviors rather than health factors. Statistically significant, albeit small, differences in CVH trajectory parameters by sociodemographic characteristics were also identified, meaning the findings provide insight into the trajectory of CVH early in life, which may contribute to CVH disparities in adulthood. Potential modifiable health behaviors for focused prevention efforts to optimize CVH in early life were identified. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Renal protective effect of metformin in type 2 diabetes patients. Background. Inhibiting the development and progression of diabetic kidney disease, DKD, is an important issue, but the renoprotective effect of metformin is still controversial. Objective. To assess the renoprotective effect of metformin in patients with type 2 diabetes. Conclusion. Metformin decreased the risk of renal function deterioration. Here are the articles from Diabetes Care. Efficacy and safety of finerenone in type 2 diabetes. a pooled analysis of trials of heart failure and chronic kidney disease. Objective: to evaluate the efficacy and safety of finerenone, a nonsteroidal mineralocorticoid receptor antagonist, in individuals with type 2 diabetes, T2D, and either chronic kidney disease, CKD, or heart failure, HF, with mildly reduced ejection fraction, HFmrF, or preserved ejection fraction, HFpEF. Conclusions: finerenone consistently reduced morbidity and mortality in individuals with T2D across a broad range of glycemia and glucose-lowering regimens. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Endovascular thrombectomy for large ischemic core stroke. A systematic review and meta-analysis of randomized controlled trials. Background and objectives. The optimal management of acute ischemic stroke, AIS, patients with large vessel occlusion and large ischemic core is uncertain. We aimed to evaluate the safety and efficacy of endovascular thrombectomy, EVT, compared with best medical treatment, BMT, for AIS, through a study-level meta-analysis and meta-regression of 6 randomized controlled trials, RCTs. Discussion. EVT improved clinical outcomes among patients with large core AIS assessed by aspects of 3 to 5 or volumetric methods. Patients with aspects 0 to 2 also had benefit from EVT and require further study. These results support expansion of the routine application of EVT. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Effective flow rates of high-flow nasal cannula on extubation outcomes. Background. High-flow nasal cannula, HFNC, has emerged as a promising intervention for post-extubation oxygen therapy, with the potential to reduce the need for reintubation. However, it remains unclear whether using a higher flow setting provides better outcomes than the commonly used flow rate of 30 to 50 liters per minute. Research question. Does setting the flow rate of HFNC at 60 liters per minute versus 40 liters per minute for post-extubation care result in different extubation outcomes? Interpretation. In unselected extubated patients, setting the HFNC flow rate at 60 liters per minute did not reduce the risk of reintubation or NIV use, compared with a flow rate of 40 liters per minute. Using a flow rate of 40 liters per minute with as-needed up titration may be a reasonable alternative to setting the flow at 60 liters per minute for post-extubation care. However, this trial may not have been sufficiently powered to exclude a small between-group difference. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Clinical and biological features of a thickened basement membrane zone in asthma rationale. A subset of patients with asthma have airway pathology characterized by a thickened subepithelial basement membrane zone, BMZ thick asthma. Objectives. To characterize the clinical features of BMZ thick asthma, and to determine if BMZ thickness accompanies specific patterns of inflammation in the airway epithelium. Conclusions. A thickened BMZ marks a subset of younger patients with asthma characterized by higher immunoglobulin E concentrations, to animal aeroallergens, and by increased bronchomotor tone, occurring in the context of airway epithelial cells, activated by IL-13, and infiltrated by mast cells. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. Dialysis dependence in standard versus accelerated initiation of KRT in A.I.O, a post-hoc analysis. Key points. The standard versus accelerated initiation of renal replacement therapy in A.I.O trial found that starting dialysis earlier for A.I.O resulted in a 74% higher risk of still receiving dialysis at 90 days. Among patients who likely would have started dialysis under usual practice, the risks of dialysis dependence were similar. This suggests much of the risk observed may have been due to starting dialysis versus never starting, rather than starting slightly earlier. Here are the articles from Kidney International Reports. Scoping review of kidney patients' and providers' perspectives on disaster management. Introduction. Patients with kidney disease are uniquely vulnerable to disasters, and the need to understand stakeholder experiences to improve disaster preparedness has been highlighted. We aimed to explore the existing literature capturing patient and provider perspectives, identify research gaps, and develop research priorities in disaster management. Conclusion. The literature examining patient and provider perspectives or experiences is scarce and at risk of bias. Methodological, population, outcome, process, and impact priorities are proposed to guide future research initiatives and generate evidence to inform context and disaster-specific relief efforts.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.